Today we will be discussing about benign gynecological diseases. We have all the commonest is fibroid, then about endometriosis and adenomyosis. In the class on AUB we have already discussed about fibroids and their management. So this class will be mainly dealing with endometriosis, and just to mention, just to recollect what we have learned in fibroid also. So these are the three common conditions. So regarding fibroids, all of you know that fibroid is the commonest benign tumor arising from the uterus. It's also called leiomyoma. It is mainly seen in the reproductive age group women because estrogen is favoring the growth of the fibroid. In the postmenopausal, usually the fibroids will shrink in size, but it is the commonest tumor in all females. And coming to the location of fibroids can occur anywhere in the uterus. So it can be based on the position. Whether it is a cavity, we call it as submucous. When it's in the uterine wall, it's called an intramural, and when it is going outside, it's a subserous. What are the symptoms of fibroid? Majority of the patients with fibroids are usually asymptomatic. Some of them will present with menstrual symptoms. That's why fibroid is an important cause of abnormal uterine bleeding. And those present with the abnormal uterine bleeding are usually submucous fibroids. And then another symptom is pressure symptoms. That is, as the uterus enlarges with fibroid, it presses on the adjacent organs like the bladder and the rectum and will produce urinary symptoms and constipation. And another presentation of fibroid is with infertility, especially when it is a submucous fibroid. The patient can have implantation problems, and in a coronal fibroid it produces tubal block. And so fibroid is one diagnosis by which we identify when we are evaluating a patient for infertility. Then these are the usual symptoms of fibroid. And another presentation is with anemia. Whenever the patient is having heavy menstrual bleeding, she will present with anemia. Then pain can be a symptom. Usually fibroids are painless whenever there is a degenerative change in fibroid, like a red degeneration. That this is a condition where the patient will present with pain. And red degeneration usually occurs in a fibroid in pregnancy. And what are the treatment options for fibroid? There are different modalities of treatment for fibroid. One we call expectant management, because this fibroid is a very benign tumor. The chance of developing into a malignancy is very